Hi, I'm Dr. Adam Zuckerman, and welcome to my Thyroid Relief website. As you browse through our site, you'll see that there's a lot of valuable information for you regarding your condition. You'll also see that you can request a free DVD, which will talk to you in much more detail about what makes our office unique and why we see amazing results. The purpose of this video is to introduce you to our office. I've been practicing in Boynton Beach, Florida since 2004. I've studied underneath Dr. Datiz Karazian, who's the best-selling author of Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And he's one of the leading researchers when it comes to thyroid conditions. I've also studied underneath Dr. Michael Johnson, who's author of the book, What Do You Do When Medications Don't Work? If you're suffering from thyroid problems, especially hypothyroid or underactive thyroid, I definitely understand your frustration and your concern. You'll learn from the information that we're going to provide for you today that we have answers for you and that we're here to help. If you're suffering from thyroid symptoms, the most common ones are fatigue, you're run down, increase in weight gain, even with a low-calorie diet, you just can't lose the weight, morning headaches that wear off as the day moves on, depression, constipation, overly sensitive to cold weather, poor circulation and numbness in your hands and feet, muscle cramps even while at rest. You catch colds and can't fight things off well. Your wounds heal very, very slowly. You require an excessive amount of sleep to even function properly. You have chronic digestive problems, itchy, dry skin, dry or brittle hair, or hair that falls out easily, edema, especially in the facial area, and loss of outer portion of your eyebrows. The outer 1/3 of your eyebrows is extremely common as well. Let's go to the thyroid basics and explain to you thyroid hormone. I find from patients coming up for consultations, very little people actually understand what the thyroid does, and we're going to go into that today. Your brain sends a signal to your thyroid via thyroid stimulating hormone. T4 is what is most commonly released from the thyroid gland, 93% of it actually, which is an inactive form of thyroid hormone. T3, which is the active form, is only produced about 7%. These hormones actually have to ride what we call a taxicab, or a thyroid binding globulin. The T4 jumps on that TBG and is taken around the body, so to places like the liver and the gut and surrounding tissues, where T4 is transformed into the active form of T3. Then the T3 hormone can enter the cells through receptor sites or doorways. So the thyroid gland secretes predominantly T4, which is not usable. T4 gets shuttled around through the body on a globulin called TBG to other places that convert it to the active form of T3, which the body can use. 60% of that is in the liver, 20% in the gut, and 20% in surrounding tissues. Every cell in your body has thyroid receptors, so your thyroid hormone is extremely important and is involved in the function of every cell in your body. Your thyroid gland supports bone metabolism, or the growth of bone, your immune system, your brain and your nerve system, your endocrine system, which are your adrenal glands, your ovaries, your testes, gastrointestinal function, liver and gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels, and even proper stomach acid. So every cell in your body has a thyroid receptor. It's what we call thyroid crosstalk. Your thyroid communicates with your immune system. Your immune system also communicates back to your thyroid. And your thyroid communicates with your intestinal tract. And your intestinal tract communicates with your thyroid. Your thyroid communicates with your brain. And your brain communicates with your thyroid. Your thyroid communicates with your endocrine system. And your endocrine system communicates with your thyroid. Every system affects another. And what we find through patients in our office is that these other systems are not typically looked at and can be leading to the cause of your problem. What we find is if you do have thyroid problems, it's what we call a chronic health condition. There are common threads for other chronic health conditions that you may suffer from that are linked to the same common denominator. So people with thyroid conditions can also suffer from things like insulin resistance or metabolic syndrome, or fibromyalgia, or chronic fatigue syndrome, peripheral neuropathy, which is radiating or burning pain in your hands and your feet, rheumatoid arthritis, irritable bowel syndrome, Crohn's disease, celiac disease, the list goes on and on. Have you been told that your lab tests are normal? A lot of times people are frustrated because they're told that their lab tests are normal, but yet they're still suffering from the symptoms. They use bell curves, and what the labs do that we typically go to down the street is we go into the lab, they take blood work. And what you have to ask yourself when you look around, who are the ones that, the people in the population who are typically getting blood work done on a regular basis? Are they sick people or are they healthy people? It's typically the sick people who are getting blood work on a maybe even twice a month basis. The healthy individuals go to the labs maybe once a year, but unfortunately we're all put into the same computer system and the same database. And when these labs come up with ranges of normal and abnormal, they're actually taking into account everybody who enters their labs for a certain period of time, and they come up with ranges based upon that. So in reality, you could actually understand that for a person to remain healthy, you're actually getting compared to sick people and ranges based upon sick people, people who have too little of something or too much of something. So what we use in our office are what we call functional lab values, which are lab values designed to help your body function better. We could actually help reveal problems before they're seen on traditional labs. We don't want you to have too much of something or too little of something. We want you to remain healthy in a healthy range. For example, TSH, which is the most common test thyroid stimulating hormone for people with a thyroid problem. Typically, labs will tell you that your range should be between 0.45 to 4.5. When it comes to functional ranges, I'm not happy unless you're 1.8 to 3.0 according to the research on functional values. So that's a much tighter range than what you're typically accustomed to, but it's a range designed to keep your body functioning well instead of reaching the outer borders of disease processes and dysfunction. So what are the typical thyroid tests that are ordered? We have thyroid stimulating hormone, TSH, and if you're lucky, some doctors will do your total T4 or your T3. But what we actually want to compare this to is we do what we call a true thyroid functional test. Yeah, we'll check the TSH levels, which is conventionally ordered, and T4, but what about this? We also look at the free thyroxine index, the FTI. It's the amount of T4 that's available. We look at free thyroxine, free T4. We look at T3 uptake, which is how much of T3 is taken up by those taxi cabs that we were talking about. We look at free T3. We look at reverse T3, how much can the body not use? We look at TPO and TBG antibodies, which are indicative of Hashimoto's disease, and we're going to get into that shortly. We look at TSH antibodies, and that's indicative of Graves' disease. And we also look at TBG levels, which are those globulin or those taxi cab levels. We want to look at the thyroid from a much bigger picture than what you typically had it looked at. So typical thyroid test order, TSH, T4, maybe even T3, we look at about 10 different tests. My thought process is, how can you possibly manage your health without all of the information? To manage your health, you need to look at the cause of the problem, not just the symptoms. And managing symptoms does not lead to better health, and it does not correct the cause of the problem. It just manages symptoms. That's all that it does. The current treatments for thyroid, despite newer medications coming out all the time, is actually a 50-year-old model of treatment of the thyroid. In fact, there was a study done back in 1998 in the Journal of Endocrinology and Metabolic Disorders that stated that 80% of hypothyroid patients are autoimmune. And this research that they did has been supported throughout the years. It's not just based upon a 1998 study. If 80% of hypothyroid patients are autoimmune, which means that your body's immune system is attacking itself, how many people out there are getting proper immune panels to determine how the immune system is functioning? If the immune system is the cause of the problem, why is it not being looked at? Hashimoto's and Graves' disease primarily are not thyroid problems. Yes, the thyroid is getting attacked, but they're actually immune system problems where your thyroid is getting attacked by your body attacking itself. So there's an imbalance in your immune system that needs to be addressed. Therefore, we need to do the proper, thorough testing. So why would your immune system attack itself? Let's just touch upon this for people who this is the first time hearing something like this. You could have chronic inflammation from anything going on. You could have poor blood sugar, bad adrenal glands, hormone imbalances, neurological imbalances. All these things can actually lead to improper functioning immune systems. How do we help thyroid issues? We remove the things that are causing the immune system problems. We modulate your immune system through nutritional and supplementation support. We support your immune system. Thyroid dysfunction is a sign of metabolic dysfunction, so proper testing is crucial. We perform complete metabolic profiles, which is what you're accustomed to, but then we go above and beyond. We do a complete thyroid panel, including including thyroid antibodies, like we discussed before for Hashimoto's or for Graves' disease. We want to look at your vitamin D levels. We want to look at anemia and kidney function. We want to check your immune system, the T and the B lymphocytes specifically. We want to look at your cortisol levels through your adrenal glands. If you remember back to the thyroid crosstalk that we were talking about, if your adrenal glands have a direct influence on your thyroid, we need to check your adrenal glands as well. We need to look at food sensitivities for things such as gluten, soy, egg, dairy, yeast. These are things that typically contribute to autoimmune issues according to the medical literature. And we also want to do a microbial profile to determine, do you have any underlying parasites or infections in the gut that could be leading to your problem? So what makes our office different than any other doctor that you've seen? I'm here to tell you that we will leave no stone left unturned to figure out the exact cause of what's going on with you. We base everything on functional values. Our nutritional products are designed to support pathways for healing. We're going to look at your gut. We're going to look at your thyroid and your adrenals. We're going to look at your liver and your biliary system. We're going to look at anemias and sugar regulation and autoimmune regulation. I also ask that patients bring in existing labs that they have and previous information about you so I can figure you out and look in depth and see how long you've been suffering from this problem and see what exactly is going on. And then we'll obviously do an overview to see is anything left out and what testing needs to be done. And we'll figure out, are you helpable and how? So on a scale of 1 to 10, I want you to really ask yourself, how serious is your problem? Is it a 1 that your problem just began and you just want to get further information? Or is it a 10 that you're sick and tired of being sick and tired? How is it affecting your relationships with your family? How is it affecting your ability to go to work or to function at work? Your ability to enjoy life with your friends, with your family. On a scale of 1 to 10, how serious are you about eliminating your problem? So I'm here to explain to you that I want you to stop suffering. There is a solution, and we're here to add value to your life. I hope you learned a lot from this, and remember, you can also request a DVD, which will give you much more information about your thyroid condition. I look forward to hearing from you soon.